Okay, so we've just finished talking about descriptive studies, and now we're going to start talking about analytic study designs. And as we mentioned before, there are two different types of analytic study designs. The first is observational, and that cohort and case control studies are observational analytic studies. And then there are intervention studies or randomized controlled trials. And so the difference between these is pretty self-explanatory. So the difference is that in the randomized controlled trial or the intervention study, the exposure is controlled. So there's an intervention. Whereas in the observational studies, you simply observe what happens in the natural world without intervening. So that's the difference between those two studies, and so two types of studies. So now we're going to talk about case control studies. So now I'm going to describe the basic structure of a case control study. And this structure is really unique to the case control study. So first, you start with the cases of the disease. So this is different from both the cohort study and the randomized controlled trial, in that in this case, in the case of a case control, you're starting with the cases. And so you can remember that by just looking at the name of the study design, that it starts with a case. So first you start with the cases, so you get the people that already have the disease. So once you have the cases, then you create a control group of individuals who do not have the disease. And this is a tricky part of a case control study, and one of the reasons that these studies are sometimes problematic is because you have to figure out how to create the control group, and that's very challenging. So the third thing that you do in a case control study is, now that you have your cases and your controls, you compare exposure in the cases and controls. Okay, again, so here we show the basic design of a case control study. So as we just said, you first come up with the cases. So these are individuals with the disease. You create a control group, which are individuals that are very similar to the cases, but who don't have the disease. And then you look at the rate of the exposure in the cases versus the controls. So you compare the exposure in cases to the exposure in controls, and if you find that the exposure is higher in the cases than the controls, then that suggests that the exposure may be causally related to the development of the disease. So a key difference between a case control and a cohort study, both of which are observational analytic studies, is that with the case control study you start with the disease. So you know disease status when at the very beginning of the study, and that's how you structure the study. With a cohort study, you do not know the disease status. Well, I'm sorry, you know for a fact that they do not have the disease, and then you track people over time to see whether or not they develop the disease. So this suggests one of the major limitations of a case control study, which is that it does not measure incidence of disease. So just like we saw with the control of the cross-sectional or correlational study, that also didn't measure incidence. Likewise, the case control does not measure incidence. So why do a case control study? Because what we want to know is incidence. So case control studies are good for investigating outbreaks where there's an urgent need to understand potential causes of the disease. So in the case of AIDS that we saw earlier, the first thing people did was look at, define the case, what a case was, and then compare to healthy controls to get some sense of what types of exposures were related to development of the disease. So that's one scenario. where case control studies are really useful. A second is looking at rare diseases or outcomes, because to use a cohort study to look at a rare disease or outcome is very difficult, because you have to gather together a population of individuals who do not have the disease and track them over time and note when they get the disease. And if the disease is extremely rare, you may not get anybody that develops the disease in a cohort study. So it's really difficult to do a cohort study with a rare disease. So those are two reasons people would do a case control study. So just a couple other things to note about the case control study. So for the cases, as we've already said, the case definition needs to be very specific. And the conclusions that you draw from a case control study are only generalizable with patients with who have exactly the same disease as the cases. So that's why it's really important to have a case definition. And as we saw earlier with AIDS, and we've mentioned since then, you can't do these types of studies without a very, very clear definition of what a case is. So it's clear that in a case control study, one of the big challenges is developing the right control group. So what's important about the control group is that the controls are matched to the cases, and you want to limit the effect of confounding variables, which you'll understand later when we talk about confounding variables. So you need to develop a set of matching criteria, which are the factors that define how the cases are related to the controls. So you want to pick your criteria by which you will select your control group. And of course, it's really important that your controls and your cases are at similar risk of developing the outcome. So that's another way of saying that you don't want to have multiple sort of increased risk in the cases relative to the controls, because then you won't really be sure about whether the outcome is related, whether the exposure is related to the outcome at the end. So we'll give an example of a case control study, and hopefully these things will become more clear. And the last set of considerations for a case control study for this video are issues related to data collection. So it's important that data are collected in the same way for the cases and controls. And this is something that frequently may seem obvious, but often it's not the case. So you might have cases that were discovered in a particular clinic and then have to go to other clinics for the controls, and say perhaps lab data were collected in different ways in the different clinics. And so there might be a bias introduced if you have different data collection methods for cases and controls. And recall bias is a major limitation to data collection for case control studies. And so the classic example of this is if somebody, say, has a infant born with some congenital disorder, that person may be more likely to remember things that they have done, exposures that they have had that might have been causally related to this congenital defect in their child, because they have been searching and searching to find an explanation for why the child has this problem. Similarly, someone with cancer might try harder to recall prior exposures because they think they might be related to the onset of their disease. So like trying to come up with reasons why you developed this disease. So that's a risk because the cases might be more likely to recall potential exposures than the controls, simply because they've been trying to explain why they developed the disease. And finally, researchers should be blind to the outcome when collecting the data. And in this case, the outcome is the exposure. So, of course, the researchers know whether the individuals have developed the disease, but they should not be aware of whether they were exposed, because that may bias their their collection of the case and control data.